At this point, it is recommended to use the NIO fixation dressing to affix the stabilizer base to the limb. Once the stabilizer base is secure, remove the trocar and place it in the needle vise sharps block found in the GoIO kit. Next, confirm successful needle placement. This can be done by aspirating for blood or bone marrow. Note that the absence of blood or bone marrow doesn't necessarily indicate an unsuccessful placement. If neither blood nor bone marrow are aspirated, placement can still be confirmed with a small flush. You should feel resistance when flushing. It should feel thick, like molasses, D50, or 50% glucose going through a 22 gauge cannula. Flush the cannula with 10 to 20 cc's of saline. Now the IO cannula is ready to use. Connect the 3-way stopcock extension set included in the GoIO kit to an IV line. The extension set allows for simultaneous administration of medications, fluids, and blood products. Note: be sure to steady the stabilizer base when connecting or disconnecting any lower lock line or syringe to or from the cannula. Do not leave the hub open to air. Connect fluids and other items to the extension set as needed. To prevent accidental removal of the IO following insertion into the proximal humerus site, immobilize the patient's arm. Use the secure IV strap to protect against accidental line pulls. Snap the line into the quick click connector channels and wrap the strap around the patient's limb distal to the insertion site. Complete the procedure by filling out the details on the patient bracelet and wrap it around the patient's wrist. Now, a few recommendations. Reassess the IO site immediately after placement verification. Frequently monitor the limb after drug administration. Continue to monitor the extremity for complications. For post-insertion monitoring, we recommend the following. When infusing vesicants, chemotherapy, and highly concentrated medications, the IO needle should be rechecked for placement and patency by confirming that the needle is stable in the bone prior to drug administration. Frequently reassess needle placement. Monitor the limb every 10 minutes for the first half hour or longer after beginning infusion per your institutional protocol. Monitor the extremity for pulse, capillary refill, color, temperature, and swelling. Document the insertion site when reporting off to the next caregiver.